এক সেকেন্ড দেখছি।
मुश्किल बात क्या है?
এখনো আসেনি। হ্যাঁ, এবারে তো ইমেল খুলে গেল তো। এবারে তো ওখানে ইমেল খুলেছে। আচ্ছা। হ্যাঁ হ্যাঁ, শোনা যাচ্ছে। ওকে। Good afternoon,
Good
Chirag
afternoon.
bhai.
Anirbanji, am I audible?
Yes, yes, you are audible.
Okay, okay. Good afternoon. Good afternoon. Can we just try sharing the screen?
Yes, yes, you can.
Yeah.
Chirag bhai, you can share your slides.
Are you able to see my screen?
No, actually. Oh, now it's visible. Yeah. No, it was okay previously. Just put it in PowerPoint mode, please.
Now
Yeah. It's perfect. Perfect.
you are seeing the first slide, right?
Yes. Can you change the slide so that?
Yeah.
Yeah. Now. Yeah.
Chat's just letting, right?
Yeah. Perfect.
Okay. Okay. Should I continue sharing my screen or should I stop sharing?
Uh, so you can stop sharing now. So just
Okay.
for a few minutes,
Yeah.
there will be introduction and all, and after that you
Yes.
can.
Yes.
Yeah. Good afternoon, Rupa ma'am.
Good afternoon, sir. How are you?
Yeah, I'm fine. How are you? After a long time.
Yeah. We are expecting some more to join, I think. Registrations are many. Yeah.
Yeah, this is very interesting topic.
Right.
And Chirag ji is very dynamic, and he is number one.
Good afternoon, Dr. Chirag.
Good afternoon. Good afternoon. कैसे हैं आप?
Yeah.
Nice meeting you all.
Right. This is that is in this pandemic has opened up this online platform.
Yeah, very true.
And that's
Very
why
true.
the world
It
has
is
become so small.
very true.
But
At
we
least,
would
at least,
also
at
love
least
to
in
have you at our institute as well. If
yeah,
you
definitely my
you
pleasure.
happen to be at Kolkata.
Definitely, Kolkata happens to be my birthplace actually.
Oh,
My Mamaji and all are still there in Kolkata.
then please come to our institute, visit our institute.
Definitely, my pleasure. Definitely, whenever I'm coming there to Kolkata, I'll definitely visit your place.
So should we start, madam?
Yes,
Yeah.
let the participants join.
Yeah.
We may start, I think.
Yeah.
Since it's dot 3 o'clock.
Yeah.
Please check with the technical team if they are ready with the Facebook Live. Dr. Devabruto, you may start, I think. Yes, thank you, Dr. Devabruto. On behalf of Guru Nanak Institute of Pharmaceutical Science and Technology, I take this opportunity to welcome all the participants in this online platform at this webinar organized by the Yoga and Meditation Club of Guru Nanak Institute of Pharmaceutical Science and Technology in collaboration with Himalayan Meditation Center. I am also very much glad to welcome Dr. Chirag Solanki to our this online platform of our institute. That he has in this busy schedule, he has given his kind consent to spare his time with our students and faculty members and share his knowledge with us. I also thank our Yoga and Meditation Club coordinator, Dr. Devabroto Ghosdastidar, and also Dr. Anirban Bhuiya sir, that they have arranged such an interesting webinar on such an interesting topic. This is going to be an a very interesting topic for all, and for the knowledge of all the participants who are not a member of these Guru Nanak Institute. I would like to add that this institute, being a NAC and NBA accredited and ranked institute, we strive to students. We also arrange several both the students as well as the faculty members. Therefore, without wasting much more time, I would like to welcome you once again and request Dr. Devobrata Ghosh to carry on with the process.
Good afternoon, everyone present in this virtual platform. I express my gratitude to Guru Nanak Institute of Pharmaceutical Sciences and Technology for providing the opportunity to jointly organize this very interesting webinar. And especially, I'm thankful to Principal Madam, Dr. Pamudra Datta, Director Sir, Dr. Abhijit Sengupta, and the Secretary of Yoga and Meditation Club of Guru Nanak Institute of Science and Technology, Associate Professor Devobrata Ghosh Dostidar, for their support and cooperation in establishment of Memorandum of Understanding between Guru Nanak Institute of Science, Pharmaceutical Science and Technology and Sri Sivakrupananda Swami Foundation. The founder of Sri Sivakrupananda Swami Foundation, His Holiness Sri Sivakrupananda Swami, has brought the 800 years old culture of meditation known as Samarpan meditation to our society. It has no advice from outside. It is simply based on the inner experiences during the practicing meditation. This has been proved to be the simple most way to stimulate the growth of a person from inside out with 30 minutes of regular meditation for 45 consecutive days. Millions of people throughout the globe have adopted Samarpan meditation as a part of their daily life. More than 60 countries have meditation centers for collective meditation. During the pandemic situation, Sri Sivakrupananda Swami Foundation had organized many online workshops and Mahasibir to unite the souls throughout the globe. The mission of Samarpan meditation is the whole world is one family. This webinar is a small step towards that. I hope all the participants will benefit out of this um, webinar. So without further delay, I would like to hand over the mic to Dr. Devobrata Ghosh. Thank you. And I would like to thank Dr. Chirag Solanki for his acceptance of the invitation. So whenever I requested him, immediately he accepted my invitation to deliver the lecture for this, for the Guru Nanak Institute. I'm really appreciate the busy schedule you have taken your time and delivering the lecture. Thank you.
Thank you very much. Thank you very much for inviting me for this lecture, and it is my honor and my pleasure to be with all of you. I thank Dr. Datta Madam, Dr. Debrata ji, Dr. Anirban ji for giving me the opportunity, and also I am thankful to the Navachaitanya Yoga and Meditation Club of Guru Nanak Institute of Pharmaceutical Sciences and Technology for organizing this wonderful event. So I will share my screen and I'll start my presentation. Is my slide visible?
Yes, it is visible.
Yes, visible.
Yeah. So today, actually, I'm going to present a relatively new topic, which is functional neuromodulation surgery. It is actually an art of taming the nervous system. So, functional neuromodulation surgery, art and craft of taming the nervous system, which is the topic of today's presentation. The functional neuromodulation surgery, if we talk about, it is actually not that a new technology or a new surgical advancement. The initial part of neuromodulation surgery in actual practice, it started in 1990s. In India, particularly if we talk about the practice of neuromodulation surgery, actually started in around 2008, 2009 or somewhere around that. And for last 10 to 15 years or so, it is present. It had this functional neuromodulation surgery has got its presence in India. So India is probably, if you can consider India particularly, India is a relatively naive country to get the benefit of this functional neuromodulation surgery, and this specialty of neurosurgery is actually not available all around India. There are extremely few centers in southern part of India. Western part of India, there are only two centers. One is Mumbai, and the second is in Ahmedabad, where in Ahmedabad we are the only center doing this surgery in western part of India, especially if we consider Gujarat, Rajasthan, and Madhya Pradesh. Eastern part of India, there are no centers. Northern part of India, only one or two centers are there in Mumbai and Gurgaon. So still, India is yet to get actual benefit out of this functional neuromodulation surgery. So coming to the history of neuromodulation, it is not actually the newest of the modalities. In 1580, Scribonius is already described, and literature is showing that people used to use a torpedo fish to give electric shock to patients during those times who were suffering from pain. To give them relief out of pain, this was the thing which was used in those times, so many years back. So these are the roots of neuromodulation surgery. So what is the contemporary definition of functional neuromodulation surgery? It is a very lengthy, very long definition, but in crux, to shorten it, it is a technique which uses the electrical stimulation, ablation, modulation, transplantation, and other modalities to relieve variety of symptoms in neurological disorders, and in turn improve the function of both structurally normal as well as abnormal nervous system. This is very important actually, because usually in most of the surgical field, medical field, we all know that whenever there is an issue, whenever there is a problem, whenever there is abnormality, that is when the medicine comes into picture, whether it is a medicine, whether it is a surgery. But neuromodulation is equally helpful in many of the diseases where there is no actual structural abnormality in brain or spinal cord. And the ultimate aim of this functional neurosurgery or functional neuromodulation surgery is to improve quality of life of the patient. That is the final aim. So there are various types of different modalities available under the roof of, under the heading of functional neuromodulation surgery, and deep brain stimulation is one of those modalities. Deep brain stimulation surgery is the one of the most commonly used surgeries at least in India at present, as compared to other modalities. So I will start with deep brain stimulation surgery first. So what is deep brain stimulation surgery? As the name suggests, deep brain. So it is the deeper areas, critical deeper areas of the brain which are being stimulated. From that's where the name comes, deep brain stimulation. And how it is done? As you can see in the picture, there are two thin electrodes which are being implanted in the brain in the specific deeper areas of the brain with submillimetric accuracy, because the brain structures where we put these electrodes are already of the size of 3 or 4 millimeters. So 2 or 3 millimeters here and there, then there is no use of this surgery. So accuracy is the most important part of this whole process. So you can see in the picture, there are two electrodes going inside the brain on both the sides, and both of them are actually connected with wires to the chest, and where the battery, in our language, it is called IPG, implantable pulse generator. It sits on the chest under the clavicle, just below the clavicle, or in the chest wall, and from that battery, the electrical impulses are actually provided, are actually transmitted to the specific areas of the brain via those implanted electrodes. So these are the implanted electrodes. These are the target areas which we want to deliver the desired electrical impulses. And this is the battery or IPG from where the impulses go up and they are delivered into the specific areas of the brain. So deep brain stimulation surgery actually started in 1990s, but in 1980s, in between 1980s and 1990s, it was the pioneering work of Dr. Krosman and Dr. Tipu Aziz, which brought into the picture the importance of or the benefit of electrical stimulation of specific areas of the brain. They actually worked on the area of the brain which is called STN, the subthalamic nucleus, where in Parkinson's disease, we deliver the electrical impulses and we get the desired significant amount of clinical benefit. So you can see this lower left picture, who is Professor Tipu Aziz. He is one of the pioneers in the world to discover this technique as well as to practice this technique for last so many years. And I was fortunate enough that I was able to get trained under him. I was able to get a significant amount of knowledge and insight about this new technology and new technique under his guidance. So I was fortunate enough to work under him in Oxford. This is where I worked in Oxford. It is the university where I worked there, and at John Radcliffe Hospital, which you can see in the picture, and I am with Professor Tipu Aziz. So going to the deep brain stimulation surgery, you must have, everybody must have heard about the heart pacemaker. Those who have weak heart and the heart is not properly functioning, they are getting this heart pacemakers to get the heart pumped properly. And brain pacemaker surgery or deep brain stimulation surgery is no different from that. The only thing is the targeting heart pacemaker surgery is heart. In deep brain stimulation, the target is brain. So in a simple language, this deep brain stimulation surgery can be called brain pacemaker surgery as well. So as I already mentioned and already told that we implant the electrodes. These are the two electrodes which are placed inside the brain. They are connected with the wires, with the IPG or battery. And there are different areas of the brain which can be selected depending on the problem, depending on the disease. The most common location where these electrodes are placed in these parts of the electrodes, active parts of these electrodes are placed is subthalamic nucleus, followed by ventroidal intermedius nucleus, globus pallidus interna, and there are many other targets which are used for this deep brain stimulation surgery. And so, as I've already mentioned, the ultimate aim of any surgery is to improve the quality of life. So where this deep brain stimulation surgery is used. So there are certain US FDA approved indications which are Parkinson's disease, essential tremors, dystonia, epilepsy, major depression, and OCD, that is obsessive compulsive disorder. So Parkinson's, essential tremors, dystonia. These three are called movement disorders because there are problems, the patients are having problems related to movements of body. So either there is increased movement like in tremors, or there is decreased movement like in Parkinson's, or there might be an abnormal movement like that is in dystonia. So these are the three movement disorders where this deep brain stimulation surgery is used. Apart from that, epilepsy. Whenever epilepsy is not getting controlled with medications, or there are no other specific resective surgeries which are available, or which are not to be, I mean, which are not possible to be done in such patients, then the option of deep brain stimulation comes for treating the epilepsy. There are psychiatric disorders like major depression and obsessive compulsive disorders. They are also US FDA approved indications. Whenever they are not medically being controlled, deep brain stimulation is very helpful. So deep brain stimulation surgery in Parkinson's disease. So it is not like that all the Parkinson's disease patients have to get this deep brain stimulation surgery. All the patients with Parkinson's disease, they have to undergo medical treatment initially, at least to start with. They are to be treated, they have to be treated with medications. But there is a problem in patients with Parkinson's disease whenever they are treated with medications, and these problems usually start after 4 to 5 years of disease process. So what happens is either the drug is not properly giving the actual benefit which it used to give in earlier days. So the actual effect of medicine stays for a very short duration during daytime. So what happens is patient has to increase the dose, or patient has to take very frequent dosages of the medications. So that is one of the problems. Apart from that, whenever the dose is required to be increased, there happens to be the side effects of these medications, which are dyskinesia. So these are the two problems which occur related to the medications. And apart from that, in many of the patients with Parkinson's, those who have tremors in hands, the tremors usually, what happens is around 50 to 60% of the tremors, they do not respond to medications at all, right from the beginning of the disease. So this is what happens, and this is all problems which a patient with Parkinson's disease has to face. So what happens, because the duration of the effect of the medication is very short and there are frequent doses which are required. So what happens is this, that there is significant amount of fluctuations. So you can see in the graph, this is the medication taken. So there will be effect of medication. The immediately effect of the medication will wear off and patient again will go into the negative state. So with each medication, the fluctuations are more because there is on and off periods in between. Apart from that, the higher doses of medications are also over the period of time lost the effectiveness. So initially the amount of medication which was effective up to this level, the effectiveness reduces over the period of time. So this is what happens with medication treatment, and usually over the period of 4 to 5 years, this type of problems are faced by Parkinson's disease patients. And whenever this sort of problems develop, that is the time when deep brain stimulation surgery is indicated. That is when it is considered. So to start with, I will show a few of the videos pre-surgery and post-surgery to show the actual effect of this deep brain stimulation surgery. So you can see in this video on left side, patient is barely able to walk even with support, and after surgery you can see him walking absolutely normally without any problems. So as I've already told, it is meant for improving the quality of life, the functional neuromodulation surgery. So the activities which this patient was not able to do earlier, he is now absolutely able to do it. He actually has started driving his four-wheeler after around 10 or 11 years or so after this surgery. So this is how the patients with Parkinson's disease get the benefit. This is another patient. She was barely able to stand, and she had difficulty in walking also and standing. You can see post-operatively after surgery how significantly that patient has improved. This is one more patient of Parkinson's disease. She has difficulty in walking, not at all able to put his foot forward to walk. And then in the next video, you can see how significantly she has improved and she has started walking. So this is about Parkinson's disease. So now coming to the another indication, which is essential tremors. So many of you would have seen the patients around you in your families, with your friends, that many people have tremors in their hands, especially when they do some work. Parkinson patients also have tremors, but these tremors in Parkinson patients, they are at rest. Whenever patient is being seated, not doing anything, at that time you can see tremors in hands. In exactly opposite situation, the patients with essential tremors, they have tremors in hands whenever they are doing something, whenever they are unbuttoning the shirt, whenever they are eating with the spoon, whenever they are drinking tea with a cup, holding in their hands. There are significant amount of tremors, and they are not able to do those activities. So this is the classical patient I'm describing who is having essential tremor. So the target in Parkinson's disease was subthalamic nucleus in brain, while in essential tremor the target is ventral-intermediate nucleus of thalamus. So patients usually get around more than 80% of the improvement in tremors, and there is significant amount of improvement in handwriting because this patient cannot write, they cannot sign. So this is how this surgery changes their lives. This is one of the patient. This is, you can see the tremors are there in hands, and the system was off. Now I am turning the system on. The deep brain stimulation surgery is already done. Now the system is just turned on, and you can see in a few seconds the tremor will stop. There it is. The tremor is gone. So this is how instantaneous improvement you can see in patients with essential tremors. Even on surgical table only, during surgery only, we see the improvement in tremors of the patients on table. Because all these surgeries are usually, in most of the cases, it is done in awake state and patient is not under anesthesia. Because during surgery, we evaluate the patient. During surgery, we assess the patient for various problems and to decide for the sweet spot in brain, where exactly we should be putting the electrode. That also is decided during surgery, depending on the improvement seen on table in specific areas of the brain when we go from outward to inward. So that is why most of the surgeries are being done awake, and patient is not under general anesthesia. So another indication of deep brain stimulation surgery is dystonia. So what happens in dystonia, in short, if I can tell you, is abnormal movements or abnormal posture of the limbs, trunk or neck. It can be either hands, legs, trunk or neck, where you can see the abnormal posturing, abnormal tightness in hands, abnormal posture, abnormal habitus of the patient you can see. And patient is not able to move their limbs, move their neck, move their body very simply, and they are in abnormal position. So these patients, ideally speaking, whenever somebody is getting diagnosed with dystonia, and to mention that most of the dystonia are very much refractory to any medications. They are very refractory, and most of them do not respond to medications at all. And the limitation of deep brain stimulation surgery is not in all types of dystonias deep brain stimulation surgery is done. There are certain specific types of dystonias where deep brain stimulation surgery is indicated and it is done. But I will not go into the details of that. But to be specific, in short, DBS is the first treatment of choice in appropriate types of dystonia. Like in Parkinson's, you should be having specific issues after medical treatment. Therapy is started after 4, 5 or 6 years or so. When patients start getting, then only DBS is considered. But in dystonia, DBS is the first treatment of choice to start with. This is one of our patients. We have operated patient with dystonia. You can see that right hand, he is not able to hold it properly. Even the left hand, he has to lift his left hand because of the tightness in the hand. Whenever he walks with this abnormal postures in both the hands. The back also, you can see it is bent and he's not able to walk straight. On the right side, you can see how normally he is able to walk, he's able to hold his mobile, he is able to use his mobile. And I just to brief the story of this patient, he is a 23-year-old young guy who actually had to leave his college because he was not able to write. The problem started with his right hand and gradually progressed to involve left hand, the whole upper part of the body as well as neck. He was not able to wear his clothes by himself. He was not able to eat with his hand. He was not able to drink. He was not able to write. And after this surgery, now he is absolutely normal. He is doing all his things by himself. He is able to eat. And after around 14 years or so, after 14 years, now he is able to write again. So it is a life-changing procedure for a patient. And as I already told, there are other psychiatric medications as well, but I will not go into the details. But the scope of deep brain stimulation surgery is not limited to this many diseases. It has got a vast amount of scope, and in coming years, in coming future, we will see a lot many indications. The lot of amount of study is going on, and there are so many diseases for surgery. This is spinal cord stimulation. This is spinal cord pacemaker. So there are certain diseases which are amenable to this problem. I'll come to that later on. But if you consider the pain is one of the commonest indications of spinal cord stimulation surgery. Although for this indication, spinal cord stimulation surgery is not being done that commonly, at least in India, as of now, because there are multiple factors like patients are probably more tolerant. We are not that much attentive to our painful situations like the Western country people are aware of. And usually the people as well as many of the medical fraternity are also not aware of this neuromodulation techniques. So that is why, and apart from that, the cost of the surgery, that is also very high. So all these are the limiting factors for all these neuromodulation surgery techniques. So if you consider pain, which is one of the indications of spinal cord stimulation surgery, the deep brain stimulation surgery comes last. We have to start with physical therapy, medications, the higher grade medications, neurolysis techniques, thermal procedures like neuroablative techniques. When all these techniques fail, then we are not left with any other options. And then spinal cord stimulation is the only thing which helps in treating these patients. So it is in toto, in crux, the technique, the principle of surgery is absolutely same, just like brain pacemaker surgery or deep brain stimulation surgery. But the target here is the spinal cord. So you can see the electrode we have placed in the spinal cord, and it is connected with the wires on the back where the battery sits. And from here, we deliver the electrical stimuli to the spinal cord, and that is how we get the benefit. So there are certain indications. So there are surgery related pains in the back as well as in limbs like upper limb or lower limb. Spinal cord, after spinal cord injury, many of the patients are left with paraplegia, that is weakness in both the lower limbs. So in that case also, the spinal cord stimulation surgery has shown significant amount of benefit, and patient has started moving their lower limbs after this surgery. Although this is not yet US FDA approved indication, but it is still under trials, and so far whatever trials have already undergone, we have got significant amount of positive results, and this is going to be the future of treatment possibility for patients with paraplegia. Those who have both the limbs, both the lower limbs, are those patients who have not got their lower limbs working. Apart from that, there are various type of pain syndromes like complex regional pain syndromes, peripheral vascular diseases, heart, chest pain patients, those who have angina pectoris, especially when there is no blockage in the coronary arteries. Despite that, somebody is not able to find out the exact cause of chest pain. Those patients, these are usually the patients of unstable angina, which we call in the medical terms. These patients are the indication for spinal cord stimulation surgery, and there is a significant amount of benefit in pain. Apart from that, stump pain, neuropathy pain, pelvic pain, other neuropathic pain syndromes like those patients who have got diabetes, peripheral neuropathies, those who have got pain related to these neuropathies, they are also significantly benefited from this spinal cord stimulation surgery. Another such modality is ITDD, that is intrathecal drug delivery for spasticity and pain. So far what we have talked about was to use the implants. All of those implants were using electrical current or electrical impulses to stimulate specific areas of the brain as well as spinal cord. But in this technique, what we do is we deliver the drug directly into the spinal cord, into the spinal cavity. Rather than taking the blood orally or giving by injectable form, the advantage of this is because the drug is directly delivered in the spinal cord, which is the target of the drug, the thousands of the dosage, the actual dosage which we take orally or injectable form, the actual dosage is the thousand times lesser than that of the dose which we take orally or by injectable form. So what happens is the lesser amount of drug is required. So lesser amount of drug is required. So in turn, it will translate into lesser amount of side effects. So this is what is the principle behind this surgery. So in this surgery, via this catheter, this is a drug pump and it is filled with the drug and it delivers the micromillimeter accuracy is maintained in this with this pump, and with micromillimeter accuracy, micromilliliters of this drug is being delivered directly inside the spinal cord, directly inside the spinal cavity, and this is how we get the benefit. So the main two indications for this technique is spasticity and pain. Spasticity is tightness. So whenever somebody is having tightness in limbs like upper limb or lower limb or trunk muscles and they are not able to move freely, that is where this technique is handy, especially when patient is not able to tolerate the oral drugs or as well as injectable drugs. And another indication is pain. Same as spinal cord stimulation, which is also useful in pain. Here the difference is the pain medications are being introduced inside the spinal cord cavity, inside the spinal cavity to get the relief of pain. So this is one of the patients. I think video is not playing. I think I am not able to play this video, but the thing is just from this visuals also you can notice that this patient had spasticity in both the limbs and he was barely able to walk with support of two people. And immediately, it is the next day after surgery. On the right side you can see, immediately after surgery the spasticity is significantly reduced and he has started walking without support. Although he was not walking absolutely normally, because this problem is since his early childhood. So for years together, he is used to walk in this way. And ultimately after surgery, once the spasticity is reduced, it is like a small child who needs to learn walking again. So he has to learn walking again with improvement in the limb spasticity. So at least he is able to stand with support and walk without support on right side after surgery. On left side, he was barely able to walk with the support of two people. Another such modality is dorsal root ganglion stimulation. It is actually, in principle, it is same as spinal cord stimulation. The only thing is the spinal cord is sitting here in the center. In dorsal root ganglion stimulation, we are targeting the dorsal root ganglion, which is the peripheral part of the spinal cord. So it is the sensory ganglion which is located in the periphery, from where the nerve roots exit, and the sensory nerves which bring all the sensations to the spinal cord, they go through this dorsal root ganglion. So ultimately, it is the modulation of pain and other sensory symptoms. Whenever patient is suffering from those problems, this technique is used. But this technique, as compared to spinal cord stimulation, the difference is this is more focused treatment. So whenever the pain or tingling or other symptoms, they are localized to specific part of the body, related to specific nerves, then we stimulate only that nerve. So patient will get the benefit. While in spinal cord stimulation, it is diffuse problem. It is the diffuse pain, diffuse issue. That is why we need to stimulate or electrically modulate the larger area of the spinal cord. This is what is the difference between spinal cord and dorsal root ganglion stimulation. Similarly, we can be even more specific, like peripheral nerve stimulation, like we all know ulnar nerve, median nerve, vagus nerve, phrenic nerve, occipital. All these are peripheral nerves sitting outside the brain and spinal cord in the body. The vagus nerve is located in the neck. Phrenic nerve is also in the neck, which goes to the diaphragm. Occipital nerve is on the back of our head. Supraorbital supratrochlear nerve is just above our eye. Sacral neuromodulation is for bowel bladder problems, which is in the backbone, and functional electric stimulation is directly applied to the muscles. So these are more focused form of neuromodulation as compared to dorsal root ganglion, spinal cord, or deep brain stimulation. So whenever the problem is related to particular nerve, or let it be managed by stimulating only a single part of the nerve or the peripheral nerve which is located outside the brain or spinal cord, then this all techniques are used. But there are separate lectures for each and every topic, so I'll not go into the details of this. But just to give you an overview of this technique, I've included this thing. So, functional neuromodulation surgery program, as I already mentioned earlier to start my lecture, that this problem of availability of functional neurosurgery, because it is not widely available in India. The reason is, first thing is a true team effort is required. So, neurologist, neurosurgeon, pain specialist, physiotherapist, psychiatrist, expert in this field only, they have to come together, and then only you can start this program, because one person cannot do this thing alone. It is a team effort, and the success of this surgery is team effort, nothing more than that. So all these things we have already talked about neuromodulation surgeries. All these are restorative neuromodulation. So in that, we already are having problems, and patients are already having problems. We are trying to correct it. We are trying to improve the patient's condition. We are trying to improve the quality of life of that patient via those surgical techniques. But why should we be thinking about those things when we already have preventive neuromodulation technique available with us so widely? And I'm proud that India is the country who has given the gift of this preventive neuromodulative technique to the whole world, which is meditation. It is an extremely powerful neuromodulator. So we all have access to it, and we all are having access to this meditation, and we should be using this technique to improve our lives, so that we should not be going towards the surgical neuromodulation things. So we can prevent surgical neuromodulation surgeries by doing meditation. So the meditation per se, it is an extremely powerful neuromodulator. And if I have to talk about this meditation and its neuromodulation effects, I can speak for hours and hours together, but already have taken so much of time. So I'll try to be as precise as possible and give you a brief idea how the meditation is a powerful neuromodulator. So how does this meditation helps us? Because what it causes is it cultivates a more resilient neurobiology. It changes, in a way, it changes our brain and spinal cord and the nervous system of our body in a way that it becomes more resilient to external physical as well as mental stimuli. There is a greater sense of well-being whenever we are doing the meditation. Meditation helps us, apart from this neurological aspect, it also helps to maintain the health of our brain as we age. Because as we all might be knowing that with increasing age, the size of our brain decreases. Our brain starts shrinking after certain age, like around 40 or 50 years or so. After that, the brain starts shrinking. And why it happens? It is basically the shrinkage of gray matter of brain. So just to give you a brief idea, our brain and spinal cord and all the nervous system, it is basically made up of two types of areas, especially if we talk about brain and spinal cord, the gray matter and white matter. So gray matter, it is the condensed area, and it contains the cell bodies. So our neurons, like nerve cells, they have two parts, main two parts. One is cell body, which is the main part, which contains the head. You can tell it as the head of that nerve, and there is a peripheral part, that is the uh, process of that nerve cell, which is called the head and legs of that nerve cell. So gray matter contains the head, that is the main soma or the body of the nerve cell, while the white matter contains the processes, that legs and hands of those neurons. So what happens with age is the gray matter, which contains this heads or the soma or the body of the neurons, it starts reducing over the period of time, and that is why our brain also starts shrinking. And with age, whatever problems we face are all related to this shrinkage of gray matter of our brain. So meditation helps in maintaining this health by maintaining the thickness of this gray matter. I'll come to that also, again also. It is mentioned later on also. As I already mentioned, apart from making our neurobiology more resilient to physical stimuli, like for pain. Just for a moment, I'll go on one side, which we already earlier we have spoken about, which is pain. There are many studies. The pain is still a very much unknown entity, and recently there are so many studies, and scientists and researchers have come to a conclusion that pain is not a single symptom. Pain is being modulated even by physical stimuli, and even more important in pain is the psychological status of the patient. So meditation is going to change the treatment scenario of the pain drastically if we all are doing the meditation, because what happens is the psychological aspect is untouched. Whenever we are treating a patient with pain, we are giving the painkillers, we are giving the injections, the pain is relieved, but again it appears. Why it is happening? In some patients the pain reappears again. Some patients are cured. Some patients have more tolerance to pain, some patients have less tolerance to pain. And all these things happen because of this psychological aspect of pain. And that is not being taken care by any means. And meditation is the only way which can take care of this psychological aspect of the pain. So it is our resilience to the mental and psychological stimuli from outside, and our body reacts in a proper way, not in an exaggerated way, so that we feel pain. That is what meditation helps, and that is what meditation changes in our brain and our body. So the same way it also helps in alleviating the mental illnesses, because mental illnesses are also related to the same thing. And I'll come to it later, because mental illness, it also has got so many problems related to neurotransmitters, which are the brain chemicals. And meditation helps in correcting the levels of those brain chemicals, by which these mental illnesses are getting cured and patients are getting benefits out of that. So in crux, meditation helps us to promote healthy and sustained focus, and ultimately the aim of neuromodulation is getting treated, is getting covered by meditation, that is improving the quality of life. That is the main aim of meditation as well. So what does meditation do to the brain? As I've already told, that the thickness of prefrontal cortex, it is the area of the brain, I'll not go into the details, it maintains the thickness of the brain over the period of time, and even researchers have found that there is increase in thickness of the prefrontal cortex of the brain, especially the gray matter, which I've already explained. And similarly, the meditators, people, researchers have found that those who are meditating for many years, so if you compare their brain to non-meditators, the size of the brain is significantly different. And those who are meditating, they have their brain of 20 to 30 years of age. So brain is not aging with your body whenever somebody is doing meditation. It is a research study by Harvard University where they have found this conclusion. So overall, the frontal cortex, prefrontal cortex, all these things, all these areas of the brain, and the thickness of gray matter in this all these areas of the brain is maintained by meditation. And these are the areas of the brain which are involved in higher order of brain functions like awareness, concentration, decision making, memory, execution skills. All these things are controlled by these areas of the brain. And definitely you can also tell that whenever these areas are healthy, the all these aspects of our functionality will be even better even if we get old. So what is this called? It is called neuroplasticity. The changes which are brought to the brain by meditation, these changes are called neuroplasticity. And the younger the age, the more is the neuroplasticity, and with age the neuroplasticity reduces. So we should encourage our younger generation to do meditation. We encourage our children also to do meditation, and the early they start doing meditation, the more benefits they are going to get. So similarly, as it is mentioned here, it takes around 8 weeks to shape your brain, especially whenever the meditation is started in an early part of the problem, early part of the elderly age group, that is around 40 to 50 years. So even if there is initial loss of gray matter, initial loss of brain, somebody would be able to restore that loss by doing meditation over the period of 8 weeks. But the regularity, punctuality is very important to get the benefits out of meditation. So it is not like that 1 or 2 days you have done the meditation and you will get the benefits. It is you have to be persistent, then only you will get the persistent benefit. Otherwise, you will not get the benefit. So I already mentioned all these things, that ventromedial prefrontal cortex is dorsolateral prefrontal cortex. All these are the areas of the brain which have got specific tasks like attention, experiences, and intellect, empathy, compassion. All these things are being controlled by these areas of the brain, and by maintaining them in a healthy state, they will help us to stay healthy, stay in a better mental and physical shape, even at the older age. There are numerous amount of studies which are available, and there might be thousands, especially in earlier days. If you talk about around 50 years back or so, there was not a significant amount of research going on meditation. But recently, if you say last for around 10 to 15 years, there are thousands of meditation studies which are available, and it is very difficult to include all of them. I will just include very few of them just to give a highlight. And the unfortunate part is that meditation in India, but still India's contribution to the research in meditation is hardly 5% of the total meditation research, which is done all around the world. So that is the sad part, and I think we should be taking this opportunity, taking this responsibility to go ahead and do more meditation research in India, because we are the heritage, we are the originator of this meditation practice, and we can be the dictators about the meditation techniques to the world. So that is what I feel, that we should be going ahead more with meditation research in India. So that is what I was talking about earlier, that what are apart from structural changes, there are some functional changes brought about by the meditation inside the brain and spinal cord. And it is by modulation or components of brain and spinal cord. So you can see here that serotonin, cortisol, DHEA, GABA, endorphins, these all are chemicals which are very much important for the functioning of the nervous system. And many of them are actually they join the two neurons, because wiring we are seeing in our home, the wires are physically connected. In brain and spinal cord, it is not like that. There is a gap between the two neurons, and how to communicate with each other via these chemicals. So they are the messengers of the brain to the periphery of the nervous system, and by these chemicals only, brain communicates with whole of our body. So what are these changes which happen when there are changes in the levels of this neurotransmitters? Serotonin levels. Is the happiness hormone, and one feels good whenever there is a higher level of serotonin, or whenever there is serotonin surge inside the brain. Cortisol, it is the stress hormone. To any physical or mental stress, the level of this hormone increases inside the body, and it helps us to cope with this stressful situation. So this hormone is getting balanced by meditation. DHEA boosts our longevity. It is the longevity hormone. GABA is also similar type of hormone, which basically has got role in pain transmission. And whenever there is increase in the GABA chemical, it inhibits the transmission of pain from peripheral nervous system to the brain. So we feel less amount of pain. So by modulation of this GABA level, meditation helps us improving the pain apart from psychological improvement. Endorphins are similar to serotonin. They are also happiness chemicals. Growth hormone, as you all know, that it is actually for the growth of our body. It is important, and the amount of growth hormone, along with increasing age, it reduces. So whenever growth hormone levels are reducing, the patient feels the changes in the body with increasing age, like weakness, generalized asthenia. All these things happen because of the lower levels of growth hormone, and these levels are being balanced. These levels are being maintained by meditation. Melatonin, one of the most important thing. I mean, around 70 to 80% of the population all around the world would be facing problem related to sleep. It is the commonest problem faced by an individual. So how do I mean, medications is not a permanent solution. You take the medication, you will get the sleep. The next day you don't take the medication, you will not get the sleep. This is what is the problem with the medication. So meditation helps to maintain and boost this melatonin levels, which is a sleep hormone of the body, and it helps to maintain the sleep cycle. The sleep awake cycle is maintained by this chemical, and meditation helps in getting us maintaining this sleep awake cycle and getting a peaceful night, adequate sleep. And sleep is indirectly related to mood and other psychological disturbances. So whenever there is better sleep, there is better mood, better psychological condition. The sleep is disturbed, the mood as well as psychological condition is also disturbed. So this is how the meditation helps. So now I'm going to show you a few images, and then I'll end my lecture here. The images which I've shown here, these are the pioneering work by Professor Andrew Newberg, who is there in US in Thomas Jefferson University, Philadelphia. He is one of the leading researchers in meditation and other spiritual practices. And he has shown, you can see this, these two images. You can see that there are the size of that red yellowish area on left side. It is relatively smaller on right side, which suggests that it is the effect of external emotional stimulus. In this case, it was emotional images which patient was seeing. So the effect of those images was less on right side, those who are meditating. So as I already mentioned earlier, to the external physical or mental stimuli, we become less labile and we become more stable when we are doing meditation. This is how meditation is beneficial. The same thing he has shown with the SPECT images, which is showing that as compared to left side, you can see that there are certain areas which are getting more activated, like front part. You can see the red areas are slightly brighter on right side, and on left side you see in this back part, the activation of these areas is less when somebody is meditating. So when somebody is in a thoughtful process, or when somebody is thinking too much, these areas of the brain are getting activated. Meditation helps us reduce thoughts, reduce unnecessary thoughts. Thereby, this area of the brain is getting less activated as compared to this side. Then comes this image. It is about the attention area. You can see the attention area is more red on this image who is doing meditation. So in short, what meditation does is it helps us improving our attention, improving our orientation. So it is very helpful to the students, those who are studying, the scientists, and each and everyone. In fact, the attention span increases drastically when somebody is doing meditation as compared to those who are not doing meditation, because there is improved attention as well as lesser amount of distraction to the external stimuli, as I already mentioned earlier. So this was the pioneering work by Professor Andrew Newberg, which he has shown that what actual amount of benefit a person gets from meditation. And objectively, he has shown all these things on MRI as well as SPECT and PET images. So thank you for your kind attention, and do meditation. So I'll be happy to take further questions if somebody has any questions. Yeah. No. See, the thing is, when no. Okay, no. This electrodes remain inside because just to give you an example of Parkinson's disease. Parkinson's disease is an irreversible disease because there are chemical structural changes inside the brain which cannot be reversed actually. So the improvement which we get from this electrodes and deep brain stimulation surgery is by electrical impulses. So once the electrical impulses are stopped, the benefit will go. That is why it is called neuromodulation, because ultimately our brain works in a circuitry. It is just like an electric circuit. Our brain is also a circuit of neurons. So what happens is when you give electrical impulses to certain parts of the brain, the function of that electrical neuronal circuit, it improves. So when it was functioning less, when you give impulses, it functions normally. So those electrodes have to be there for the rest of the life, so that we can give continuous impulses there, and there is sustainable, persistent improvement out of that surgery. Once you take out that electrodes, once the electrical impulses are stopped, the benefit will be gone again. So electrodes have to stay there only; they cannot be removed. Yeah. Yeah. No. Samarpan meditation. Yeah, no, Samarpan meditation, we are analyzing the data. We have done a number of studies, but those are under the process of analysis, and ultimately then only we'll be publishing the data. At present, we have not yet concluded. We have got significant amount of positive benefits, but the images which I had shown, I already mentioned in the presentation also, those were the images from the pioneering work done by Professor Andrew Newberg. He is who is a leader in world in meditation research actually. Yeah. Yeah. See, the thing is, there are certain types of invasive monitoring as well as non-invasive monitoring. So, whenever we are doing any invasive monitoring or any uh, imaging techniques or blood analysis or EEG monitoring, whenever you are applying this type of clinical research related things like MRI study or CT scan or EEG or ECG or glucose monitoring or whatever it may be. So whenever you are doing research and whenever you are using this medical modalities to assess the patient's condition, you need to have ethical as well as ethical clearance as well as consent of the patient on paper. Questionnaire. Yeah, yeah. For questionnaires also, in fact, the questionnaire, whenever somebody has prepared a questionnaire, which can be circulated online also, that questionnaire needs to be authenticated by authorizing signatory or authorizing body. Like a questionnaire related to benefits of meditation. If you have prepared a questionnaire and you give it to the meditation practitioners and some normal people, about their lifestyle, their moods, their problems, their benefits out of meditation. Then also there has to be a body who have evaluated that questionnaire. Then only that becomes an authenticated process that you can go ahead and do the study, and it helps when you are publishing that study, because without authentication of that questionnaire, it becomes difficult for somebody to consider the validity of that questions. So whenever somebody wants to publish those studies, it is very important to get everything authenticated. Everything is done with consents of the participants, and whenever required, all the ethical and other committees should clear the process of the study. Yeah. Yeah. Absolutely. I think rather than taking the medications, I would suggest that you should start doing the meditation. And meditation, I already mentioned in my lecture also that meditation is a powerful sleep inducer. It acts by reducing the mental stress as well as by increasing the levels of melatonin inside the brain, which is a sleep hormone in a way you can say. So meditation is a powerful way, very effective way to get proper sleep and get the sleep awake cycles regulated. It is, and only thing is the important thing somebody has to remember is it is not like that you will get the benefit out of meditations overnight. Like you have done meditation for 1 or 2 days and you will tell that still there is no improvement. I'm not getting the sleep. It will take some time. Only thing is you have to be persistent with the meditation to get the desired benefits out of meditation. That is the most important thing. Yeah. Yes. Absolutely. So, see, in a way, meditation, if you talk about meditation, different meditation techniques, there are different ways. I mean, there are different ways to uh, uh, bell a cat, actually. So, uh, to explain it with an example is there are certain techniques which involve certain objects to concentrate, like tratak. There is a diya which is lit. That there is a fire which is lit, and somebody has to look at those. In some meditation techniques, they will tell you to concentrate on something, like whatever outside noises you are hearing. In some of the techniques, they will be telling you to concentrate on your breath. So, in a way, these techniques are actually the facilitator to concentrate, to get concentration. And just like a child who is studying in a school, that child will require some amount of strictness from a teacher, some amount of certain techniques, so that that child can concentrate. But it will not be the same thing which will be required for a college student. So college student will not need those strictness that you have to concentrate on a blackboard, if somebody is writing, just like a school student. Similarly, these meditation techniques are basically giving a medium to concentrate on something, by that leading into meditation. Concentrating on something is not actually meditation, but it is the way by which somebody goes into the meditation. So those who are starting their practice, they might need something to concentrate, to meditate. But as you progress, as you do meditation regularly, then you will not require all those things, physical things, to concentrate on, or to get involved with those things to do meditation. So in a way, the techniques are different, but the aim is same. The techniques are different, but the levels are different. Like starting from some preliminary level to the college level, something like that. So this is how they are different. So some meditation practices are very easy for those who are starting with, those who are doing for meditation for the first time, and other technique might be relatively tougher. The other technique might be relatively more tougher. So something like that. But ultimately, the aim of any technique, aim of any meditation technique is the same. Yeah, please. Yeah. Hmm. Hmm. Yeah. 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 See, the chakras, medical point of view, the chakras are relatively different. Medical point of view, if you see anatomically, you cannot point out a certain chakra to certain area. It is basically the conglomeration of nerve cells or nervous plexuses inside the body. So chakras are like Sahasrara chakra, which is located over the top of head. But anatomically, if we see, when you are putting the electrodes inside the brain, it is not the area of the brain which we are seeing on MRI or CT scan that this is Sahasrara chakra. It is not like that. In a way, as the way I understand is, all these chakras are basically not particularly, they are anatomical areas of parts of or the parts of the body. They are more of a functional areas of the body, like Sahasrara chakra, which is more related to brain. Then comes the Agya chakra. Agya chakra is more related to the neurohormonal system, like pituitary gland, right? Something like that. So each and every chakra is not an anatomical thing which you can see on the scan. So what we do in surgery is, we select the specific areas of the brain which are of 4 or 5 millimeter size. They are very small, which can be seen on good quality MRIs. and we target only those areas. So that is why I also mentioned earlier, it is the sub-millimetric accuracy which is required for the successful surgery. So whenever you are off target by 2 millimeters or so, then there will be no benefit out of surgery. So chakra is a different thing. It is more of a functional part of the body, conglomeration, concentrated conglomeration of a function. While what we are targeting on deep brain stimulation surgery is the anatomical target, the structure which we actually see on MRI. Chakras you cannot see on MRI. Yeah, absolutely. Why not? Because I mentioned earlier in my lecture also that the brain, uh, the thickness of gray matter of the brain, which improves and which improves by meditation, as well as the meditation sustains and helps to maintain that gray matter amount of the brain. And ultimately, it is the gray matter which is very important aspect of functioning of the various circuits. Similarly, the memory circuit of the brain, if the specific areas of the brain like hippocampus, dorsolateral prefrontal cortex, when these structures are maintained in proper health by meditation, your memory also will be maintained. If the gray matter level, gray matter thickness of these areas improves with meditation, then memory also will improve. So that is what is this is already proven by so many studies. So definitely you will get the benefit if you do the meditation. But only thing is, as I already mentioned earlier, I will tell it again and again, persistence is the key. It is not the overnight process. My pleasure. Yeah. Thank you very much. Thank you very much for this kind gesture. And actually, I am thankful to you, to all the organizers, the institutions which are involved in organizing this wonderful seminar and wonderful talk. And there are so many participants. I think I can see if there will be more than hundreds of participants who have joined from all around India. So thank you very much for this great webinar, organizing this great webinar and inviting me for this, for giving this lecture and giving me the opportunity. Thank you very much. And thank you very much for this wonderful certificate which you have given to me, which is presented to me from your institute. Thank you very much.
Sure, sure. Thank you so much, Dr. Chirag. Yes, yes. Yeah, now we can. Yeah.
Yeah. Thank you. Thank you very much.